Exactly is pain management. The term gets bandied about here and there. Pain management is basically skills that you can acquire to help you manage pain so that you can function in life. That's basically what pain management is. So basically the pain anxiety cycle is this. Somebody goes into pain, anxiety builds up, the anxiety feeds into the pain, potentially giving the perception of more pain. More pain ensues, the anxiety increases too. So it just keeps going on and on. As a therapist, my function is to cut that pain anxiety cycle so that the person starts feeling. So one of the stumbling blocks to healing is becoming pain focused. So sometimes what happens is the patient becomes so focused on their pain that it affects their life in a negative way. They are unable to function because they surround themselves with the thought of the actual pain or potential of pain occurring while they're doing things throughout their daily lives. My strategy in regards to taking the focus from pain away from patients is I get them to realize, or I ask them questions in regards to things that they can actually potentially feel. For example, like, is their pain becoming less intense? Is the duration becoming less? Is the frequency becoming less? The quality, the character, so on and so forth, so that when you ask them, they can give you answers. They'll look back from the week before, for example, and say, yeah, you're right. You know, the duration was less, the pain was less, and the frequency was less. When they're able to spit it out and say these things to you, it gives them a reminder that, yeah, they're actually feeling a little better. Because sometimes what happens is when the person gets into a point of pain, they fail to realize that there are actually things that are happening that are positive. So what I have to do is I have to get them into a positive mindset by asking those questions. So some less obvious reasons for people feeling pain, and I've talked about this many times over in previous segments, is stress and anxiety, work stress and family stress, personal stress, so on and so forth. So what can happen is that people have what I call weaknesses, and those weaknesses are more prone to stress. So for example, some people that get into, they may get pain like headaches, they may get arm pain, shoulder pain, hip and glute pain, and there seems to be a pattern when their stress becomes increased, the pain becomes more increased in those areas. And that's basically something to think about in regards to when you're under a lot of. So there definitely are social impacts in regards to pain or the lack of pain management in regards to patients. So what I might see or hear from them is that they may be fearful of going out, hanging out with friends in case their back gives out, in case they start feeling the pain, and they tend to want to stay indoors. I encourage them to go out with friends, and to not be as fearful. I know it's difficult, but to not be as fearful in regards to potential pain that may be caused. So there definitely is a social impact, and when there's a social impact, that eventually gets you back in terms of you as an individual suffering. So one of the self-care tips that I've given out many times over to people that potentially suffer from chronic pain or suffer from the pain anxiety cycle is this. It's a small and simple breathing exercise, and basically what I tell them is that when they start noticing that they're starting to feel pain, is to breathe in through their nose and then breathe out through their mouth. The key thing is we're going to use color, so you're going to use your imagination with this visualization. So what you're going to do is you're going to take blue clean air up the nose, breathe it in, and then you're going to slowly breathe it out as black or gray smoke. So the blue symbolizes the cleansing effect of the air, and the smoke is basically the negativity or the pain that the person might feel. And you do this for 5 minutes, and what will happen is that your body tends to settle down and the pain tends to be more livable. Give that a try. So as an RMT, I've been at this for quite a while, and I do suffer from my own pain. So because of my posture, because of the style and technique that I have, often I get asked, so do you have any injuries? In fact, I have injuries that I work through as I'm treating people. So a lot of the times, my injuries are actually not in the hands and forearms as people would suspect. It's actually my hip. Because of my constant rotation and twisting. So what I need to do is when I go to the gym, I focus on the rehabilitation aspect to make sure that I stay functional for the job that I have to do.